Ms. Nivetha N, Assistant Professor cum Respiratory Therapist from the Department of Respiratory Therapy in Yenepoya School of Allied Health Science, Yenepoya deemed to be university. Today I am going to talk about sleep architecture and changes to sleep. At the end of the session, the audience will be able to define the stages of non-rapid eye movement and rapid eye movement sleep, list the characteristic features of each sleep stages, describe the progression of sleep cycle throughout the night, explain the role of circadian rhythm in regulating sleep architecture, illustrate the sleep state changes using hypnogram, understand the physiological changes that occur during sleep. Sleep is a natural and periodic state of rest during which the consciousness to the world is suspended. As a human body needs food, water and oxygen, we also need sleep to survive. Sleep is the state during which the body and mind are allowed to rest and become restored. As I told, we need sleep to survive because there are some vital functions which occur during sleep. Physical growth and restoration. So, during sleep, the growth hormone is released which aids in rebuilding muscles, bones and tissues. Cognitive function and memory consolidation. Sleep strengthens the neural connection which enhances cognitive function. Our factual memory are enhanced during slow wave sleep, whereas problem solving and critical thinking are processed during rapid eye movement sleep. Emotional regulation and mental health. Sleep stabilizes the mental health. A lack of sleep can hyperactivate amygdala, which is the emotional processing center of brain. This hyperactivation can lead to heightened emotions. Energy conservation and metabolic regulation. Sleep conserves energy by decreasing the body temperature, by decreasing the metabolic rate. Cardiovascular health and blood pressure regulation. During sleep, our blood pressure and heart rate are regulated. This reduces the risk of heart disease and hypertension. Sleep strengthens the immune system by enhancing the production of immune cells, T cells and cytokines. Hormonal regulation. Sleep regulates the hormones like melatonin, cortisol, insulin. It also regulates hunger hormones like leptin and ghrelin. This is the recommended sleep duration according to American Association of Sleep Medicine. This image represents various life stages and their changing sleep requirements. First, toddler. A toddler of age 1 to 2 years requires 11 to 14 hours of sleep. This hours of sleep is important for rapid growth and development. Preschool kid of age 3 to 5 years requires 10 to 13 hours of sleep. This hours is essential for cognition and physical development. A school-going kid of age 6 to 12 years requires 9 to 11 hours of sleep. This hours is important for memory retention, learning and physical growth. Teenage requires 9 to 10 hours of sleep. During teenage, the sleep architecture slightly changes, whereas late time to bed increases during teenage. Adult of age 18 to 64 requires 7 to 9 hours of sleep. This sleep need is very essential and it has to be consistent for memory, productivity, health and cognition. An older adult of age more than 65 requires 7 to 8 hours of sleep. As an adult becomes old, the sleep needs slightly decreases. Even though the sleep requirement decreases, the quality of sleep is very essential to maintain health and cognition. Circadian rhythm. What decides at what time we have to sleep, what time we have to stay awake? It is circadian rhythm. Circadian rhythm is nothing but an internal clock which repeats itself for every 24 hours. This is controlled by the suprachiasmatic nucleus which is located in the brain. When there is light, exposure to light decreases the melatonin which sets the rhythm and we will stay awake. When there is darkness, melatonin increases, slowly we will tend to sleep. Circadian rhythm also controls sleep pattern and hormones and body temperature. A change or misalignment in the circadian rhythm might lead to circadian rhythm sleep-wake disorder. Sleep architecture. To see about sleep architecture is a structural pattern of sleep cycles which can be visualized by histogram. The main component of sleep architecture is stages of sleep. There are two main stages of sleep. One is non-rapid eye movement sleep and rapid eye movement sleep. Non-rapid eye movement sleep is the sleep where the muscle tone is maintained. Rapid eye movement sleep, which is also called as dream sleep, is the sleep when muscle atonia occurs. Moving on to non-rapid eye movement sleep, based on the EEG changes, this non-rapid eye movement sleep is further divided into three stages, which we call as N1, N2 and N3. This rapid eye movement sleep and non-rapid eye movement sleep occur in alternating cycle. Each will last up to 90 to 100 minutes with a total cycle of 4 to 6 which occurs throughout the night. Generally, in a healthy adult, non-rapid eye movement sleep accounts for 75 to 90% of the total sleep time. This non-rapid eye movement sleep is further divided into three stages. N1, which is the transitional stage, it occurs for 5 to 10% of the total sleep time. N2, which is the intermediate stage of sleep, takes the largest portion, which is 45 to 50%. N3, the deep sleep and also the restorative sleep, occurs for 20 to 25% of the total sleep time. N1. As I told, N1 is a transitional stage. This is the stage where transition happens from wake to sleep. This stage typically lasts for only few minutes. The brain activity will slow down, breathing becomes more regular and heart rate begins to slow down during the stage. This stage makes approximately 5 to 10% of the total sleep period. A person who is in stage N1 can sometimes detect and respond to the external stimuli. As it is not a deep sleep, it is just a transitional stage. An increase in stage N1 often indicates increase in wakefulness and disruption. Stage N2. In this stage, there is a decrease in muscle activity and brain activity, which is characteristic of this stage. This stage makes approximately 45 to 50% of the total sleep time. When we see the EEG in this stage, there is a relatively low voltage and mixed frequency. And when we see the EMG, which is for the muscle tone, there is a moderate level of amplitude and absence of eye movements. Eye movements will be completely absent during this stage. In addition to the EEG changes, in this stage we can see two components called as K complex and sleep spindles, which originates from the central region. During this stage N2, the senses begin to block from external stimuli. Slowly the person's senses will get blocked to external stimuli and they won't respond to external stimuli during N2. Increase or decrease in this stage may be a better indicator of significant problem during sleep. If there is an increase in N2, it might cause a decrease in other stages like N3 and stage REM, which indicates sleep disorders. Stage N3. So this stage is the deep sleep stage, which is also called as slow wave sleep. N3 is considered to be the extremely deep stage of sleep because subject finds it difficult to be awakened out from this stage. This stage makes up to 20 to 25% of the total sleep time, and this stage predominantly occurs during the first third of night. During this stage, the brain activity slows down and the body becomes more relaxed to the point of mobility. So all these stages, all this slowdown of brain activity will be very low when compared to the previous stages. During this stage, the body does all its restorative work. So during the stage N3, our bones, muscles and tissues are repaired and rebuilt, and our boosting of our immunity also occurs during this stage. Finally, stage REM. Stage R is characterized by a low voltage mixed frequency EEG pattern and, as the name tells, rapid eye movement. And when we see the EMG, which denotes the muscle tone, it will be the lowest relative to all other stages. This stage makes approximately 20 to 25% of the total sleep time, and it is often referred to as paradoxical sleep. It is called as paradoxical sleep because the brain activity remains similar to that of wake, but the muscle is temporarily paralyzed. Stage R periods are typically shorter in the beginning and they progress. So initially when we start to sleep, stage R periods, that is the REM sleep, will be shorter during the beginning and slowly it will progress towards the night and to the early morning. That's why we get more dreams in the early morning hours. This stage is restorative for mind. Researchers have found that if there is a decrease in stage R, it might lead to diminished memory. The average latency of stage R is 90 to 120 minutes. So the time taken for a person to enter this REM sleep will be 90 to 120 minutes. This is a normal sleep hypnogram. So in this hypnogram, we can see the patient is awake and slowly the patient enters stage N1 and then N2 and then the patient stays in N3 for some time. And in the second hour, the patient enters REM. So here we can see REM sleep. And this is also REM sleep. And again here we can see REM sleep. So here we can see N3, the patient's N3 sleep, N3 sleep. This N3 will be increased during the first third of night, and it will slowly decrease throughout the night. Whereas when we see the stage N2 is consistent throughout the night. Here we can see N2, here we can see N2, again N2 here, N2 here, N2 here. And REM sleep, when we see the REM sleep is present during the first hours and it slowly increases in duration, peaking towards the final hours. So this N3, presence of this N3 denotes restorative sleep as we discussed earlier. And we can see N2 which is consistent throughout the night. And REM, when we see the REM sleep is present in the early hours and its duration slowly increases, peaking at the final hours. So this denotes a very good restorative sleep. And here also we can see some intermittent awakenings which can be seen here. The patient is awake here. So this is one awakening that happens during the night, but after that immediately the patient's sleep is restored. So this denotes a good restorative sleep. This graph, unlike the previous one, it shows abnormal sleep hypnogram. Here we can see the patient is awake and the patient enters stage N1, N2 and N3. When we see stage N3 first, N3 is present only once throughout the whole night. So N3 is present only once throughout the whole night. And frequent awakenings, here we can see frequent awakenings which denotes a fragmented or disrupted sleep. So we can see many awakenings here. 1, 2, 3, 4, 5 and so on. So many awakenings are there which denotes a disrupted sleep. And when we see REM is present, but REM is not REM sleep is present, but REM is not that of the normal sleep architecture. The REM sleep hours is reduced, which can cause impairment of the emotional regulation, and decrease in stage N3 denotes a very poor restorative sleep. This type of sleep hypnogram can occur due to various reasons like insomnia, stress, anxiety, or sleep related disorders, obstructive sleep apnea, or age related changes. So a change in sleep architecture can be due to any disorders or due to physiological changes. Today we will be seeing about the physiological changes that causes change in sleep architecture. One is sleep and aging. As human age, there is various impact on sleep, and with age there is a decreased need for sleep. The arousal index tend to increase as adults age. Arousal index is nothing but the awakening. So the times they awaken during night increases as the humans age. This increased prevalence of arousal may result from various factors. It can be due to stress, it can be due to medical condition, due to medication, due to respiratory or any limb movements, or due to sensitivity to the environment. This change in the sleep architecture and reduction in sleep quality experienced by the adult can most commonly result in complaint of insomnia. The other physiological process that causes change in sleep is pregnancy. So pregnancy can cause a significant change in women's body. A weight gain is one of the most important change which occurs during pregnancy, which causes a significant change in the sleep architecture. This additional weight caused by pregnancy, especially in the thoracic and abdominal areas, can increase the likelihood of obstructive respiratory events, especially apneas and hypopneas. The comorbidities of obstructive sleep apnea syndrome often increases in frequency and severity during pregnancy, such as morning headaches. Morning headaches will be increased due to frequent desaturation during the night and carbon dioxide retention. And then decreased stage R. Decreased stage R can be caused due to apnea which will cause frequent arousal and disrupt the stage R, and apnea will be high during stage REM. Increased EEG and arousals and awakenings. Due to the presence of apnea, there will be micro arousals for breath restoration. This can cause increase in arousals and awakenings of the patient. Next is increased blood pressure. Due to the intermittent hypoxia, stimulation of sympathetic nervous system will increase the blood pressure in this pregnant women. Apart from obstructive sleep apnea, there are other reasons which might also cause change in sleep architecture in a pregnant woman. One is fragmentation of REM sleep. So the periods of stage R are mostly longest in the morning hours. Due to morning sickness, nausea and frequent urination, frequent arousals will occur during morning hours. This will disrupt the stage R. Due to disruption of stage R, they can have impaired emotional regulation and heightened emotions. Leg movements. When we see leg movements, both periodic limb movement syndrome or restless leg syndrome occurs during pregnancy, and it's also increased. This mainly occurs in the third trimester. This can be due to iron deficiency or can be due to hormonal changes that occurs during the pregnancy. So understanding these changes and understanding how to maintain these changes is very important for the growth of the fetus and the health of the mother. Summary. Sleep is one of the most important functions that human body performs. The circadian rhythm affects our alertness and also sleep patterns at night. Misalignment of this rhythm can lead to circadian rhythm sleep-wake disorders. Human sleep architecture consists of stage, wake, N1, N2, N3 and stage R. Many changes occurs in our sleep pattern as we age naturally. As we age, the sleep needs slowly declines, but still the quality of sleep that we need is essential to maintain a health and cognition. Pregnancy can also have a great effect in sleep in women. Understanding these changes that occur during pregnancy is very important for maintaining the fetal and maternal health. These are my references. Thank you.